All right, 10:01, we're going to get started here. Welcome to our discussion today titled What You Need to Know About HIPAA Security and Privacy Compliance in 2020. I know, very riveting. So a few things worth mentioning. We are recording the webinar this morning, and we'll send that link out to those that have missed it. Also, I'm going to cover a lot of topics, high level, and going to try to go at playback speed of 1.25 to 1.5. So pay attention. We're going to try to consolidate this all into 30 minutes, 30 to 35 minutes to give you some of your day back. Also, I do have some questions I'm going to ask throughout the presentation real time, so make sure you've got somebody designated to answer those questions. We'll share some of the results. I think you'll find those very interesting. And then again, thank you for taking the time. I know you're busy, and this is hopefully going to address some of the challenges that we're seeing in the industry. So first things first, a little background. This is me. I've been doing this for a long time, and one of the co-founders of HIPAA One. We were acquired last year by Enterprise Health, and it's been a fun and eventful year. They brought a lot of things to the table that we didn't have in the way of services, high trust, integrated risk management services and software platforms. So it's been a very fun and unique journey the last year and 3 months ish. And a little bit about them. They do have, as I mentioned, a very deep bench of subject matter expertise in a variety of services. So again, if some of the things we talk about today or mention a little bit, you haven't heard of those before from HIPAA One, happy to have some of those one-on-one conversations with you. We also have a new NIST assessment platform that is just being released, so that might be something of interest as well. Another important note, since we've been doing this the last 8-9 years, we have 100% pass rate in responding to these OCR audits. We know what we're doing here. Our agenda for today, and again, I'm going to try to go as fast as I can, and if you do have questions, feel free to put them in the chat, and we'll address those either real time or at the end here. But we want to go through what are the updates, to STARK laws, HIPAA High Tech, and Safe Harbor. What are the proposed changes to these rules, and in addition to the privacy rule? Second is, what are your responsibilities as it relates to those rules and as it relates to HIPAA? And then most important, what are the common mistakes we see? We have over 8,500 client sites using our software, so we have a pretty good depth and knowledge of what some of the challenges you might be dealing with. Today, I noticed we actually have groups from dental, a lot of legal, clinics, hospitals, payers. It feels like we've covered the gamut. We've got a lot of folks on the call today. So what we are going to share is very applicable across all of those specialties and disciplines. And then very important, how can you approach your security risk analysis for the year? What are some different methods that you can use, whether you use our software or whether you're doing it on your own? We'll share some of the things that'll help you automate that process. So at a high level, 2020 until now, 2020, we had the CARES Act. And the essence of that CARES Act was to expand the ability of healthcare providers to share records, of individuals. This has traditionally been fairly difficult, in the past. And what can and what can't we do? 2021 introduced some safe harbor laws, and this was more in line with adopting a framework. Well, look, there's a lot of cyber risks out there. What do you need to do? Well, it's adopt a framework, and that will help identify gaps and put corrective action plans in place so that you're not one of those victims of a breach. And then 2021, this is more geared to EHR vendors, prohibiting them from blocking information. Look, this is the patient record. That's why we call it a patient record. And that individual should be able to travel from organization, hospital, clinic, utilizing different EHR software, and have the ability to have their information readily available to care for whatever issue they're dealing with. So that's what that introduced. And then finally, 2022, we've got the final rule on some of the proposed changes, and we'll talk about that here in a bit. So why do these changes continue to happen? What are the goals of these? We want to better support individuals in their care. That's really the reality. And if you remember, anyone on the call, do you remember back in the 1900s, seems like so long ago, there was these manila folders and they had alphanumeric stickers and there was this file room. Those that are new to healthcare or young have no clue what we're talking about, but that's the way we used to do it in the olden days, the pioneers in the 1900s. So fast forward, times have changed. A lot of electronic information, you'd think it would introduce the ability to share this information more readily, as opposed to that manila folder that we had to take out, scan, or fax it to another doctor across the town or in another state. And then there was some rules and regulations on what you could do there. Enter HIPAA. And that's why we've had some of these changes. But we wanted to remove barriers to coordinate this care amongst providers and also reduce the regulatory burdens in the healthcare industry as a whole. So now, I'm not going to say that that goal has been accomplished. That's a completely different discussion based on which physician groups you speak with. But the message is we have this new process. It's not going away, and we need to expand our ability to allow individuals to access their own patient data. Okay, so that's where we are today. 2018 and 19. It was interesting, a lot of focus on enforcing these HIPAA violations, and then 2020 sets in. There was 13 million in fines, and this is what is public record. I'm sure there were more, but according to HHS, 2020 we had 19 settlements at around 13 million. 2021 we saw a drastic increase in the number of penalties for small healthcare providers. Well, what does that mean? Typically, in the past, it was 500 or more employees. That's who was typically being targeted. And a lot of the smaller groups that we worked with, they said, you know what, it's not going to happen to us. We're going to fly under the radar. We're too small. And we would hear that for years. Well, unfortunately, 2021, we saw a lot of smaller organizations finding themselves in hot water based on what they did and what they did not do. And we'll talk about some of those things here in a minute. And then 2020, we're waiting to see what the OCR's approach to enforcement. With COVID, there was a little bit of a pause button pushed. That pause button has now been removed, and we're moving forward. But we're starting to see continued breaches and continued investigation, which will result in additional fines. So that's something we need to be very cognizant of. So here's the question. You don't have to answer this out loud. This is just a rhetorical question, but why is this continuing to happen? Why are we continuing to see data breaches, HIPAA violations? They're becoming more commonplace. It didn't seem like that was the case back in the day with those manila folders. I mean, you almost had to pull you remember Chevy Chase breaking in and looking at the file record. Again, the younger generation has no idea what I'm talking about, Mr. John Cocktoaston. But if you are not part of that world that is still doing paper charting, there is a big problem, and it is going to continue to happen. It's going to continue to get worse. And we're not trying to present, hey, the boogeyman's here and going to get you. It's just a reality. The reason is it's very lucrative for these cyber terrorists. We're finding that the security measures that your organization has put in place, and let's call these doors and windows, they're being left open. We're finding some employees are actually holding the back door open for these cyber terrorists. And this is why it's important to complete a comprehensive security risk analysis. I spoke with a CIO of probably one of the largest health systems in our area and said, what keeps you up at night? What's your big stress? And I tease them as well. They're like an IT security company that practices healthcare. You probably know who they are. And he said, we're the Fort Knox. We've got amazing security. We've spent a ton of money. It's the employees. He said, that's what keeps me up at night. There's attrition. There's new employees, getting them trained. Please don't click on that Amazon link. He said, we can't install enough software to prevent all the new threats that are being introduced on a daily basis. So this is why doing that security risk analysis gives you a really good shot. It helps you identify gaps in compliance. Where are you at risk? And then it helps you put a corrective action plan in place and then prioritize those risks and work on the ones that a breach is most likely to happen. And again, training your patients, training your staff, if you're taking notes here, train your staff, constantly train your staff on what to do. We see as a cybersecurity and compliance organization, constant barrage of spear phishing attacks coming in, these emails, click on this, click on that, from our CEO. And some of them are really good. So you've got to be aware and you've got to be on top of that, training within your staff. Why is HIPAA so important, and why should you care? I just mentioned this previously. The number of attacks are on the rise. That's one of the scary things. Employees, we identified, they are the biggest risk, and you're also a steward of this protected health information, this EPHI. I've had my information, I've gotten a wonderful letter, hey, your information's been breached, and it's frustrating. So it's something we need to continue to talk about, continue to bring top of mind so that we're aware. Now, here are the most common violations in 2020. We saw the number one, failing to perform an enterprise security risk analysis. And you might say, hey, well, we did one, we're good. Over 80% of those fined, this was fascinating to me, in 2020, they were due to failure to properly conduct an assessment. Not that they didn't do it, but it wasn't done correctly. That's fascinating. So there is a process, there is a methodology to using. A year prior, in 19, about 27 million records were breached by hackers and other unauthorized access efforts. And these are, internal employees, loss of paper records, x-ray films, things like that. That's why they, in 19, HHS increased the monetary penalties for these repeat offenders. And there's different tiers of culpability. And it really is up to the discretion of the OCR auditor. That's the fascinating thing. What do they have for breakfast? Are they in a grumpy mood? How kind are you to them? I mean, it is a little bit arbitrary what they can charge, which is unfortunate. But the maximum penalty, they have put a cap on that at 1.7 million. So 1.754 million per violation penalty tier. So it is important. The risk is there, and we want to be careful that we don't find ourselves in that mess. We find another big one, failure to implement policies and procedures. This is a big one. What are we going to do? What's a sanction? If there are violations, how do we treat that? How do we treat employees that leave? Does HR notify IT to disable their passwords? We ask that question in our software, and we always, oh yes, we do. And then we ask IT, hey, did you receive notification from HR of an employee termination or leave so that you can disable passwords? And sometimes they'll say, no, we didn't get anything. So that could be a potential breach. Someone has access to your system and they're no longer an employee. We want to be very careful that we have policies and procedures in place to address that. And another one is failure to provide this annual HIPAA compliance training. This is a big one. I know it's annoying. There is really no, I've spoken to HHS and OCR about this. What is the content and what is the duration of time needed? And they don't really give a clear answer. The important thing here is that you do it and that you track it. So make sure that you have documentation. So take note of that. Every employee needs to have taken that training at least once a year, and you need to track who took that training. If you have quizzes or tests, implemented, that's even better. So these are some of the excuses that I hear why we haven't done a security risk analysis. But the nice way of saying that, here are some of the barriers to achieving HIPAA compliance. It's time consuming. It is. If you're doing it on your own, it's like digging a foundation of a home with a shovel. There's heavy equipment, there's software, why not use it? It is a large administrative burden. We sometimes find that in smaller practices, they don't have a designated HIPAA security officer. They don't really know how to spell HIPAA. They don't care and understand what it means, but it's very important that you navigate through this process regardless how you do it. The manual process with spreadsheets, emails, this collaborative approach, it's pretty messy. It's a very tedious task, and then lack of internal resources, reporting, building that final report. So there is a better way to doing this. So I've got a question I want to throw out there. So somebody jump in front of the computer, launch this question. 2021 was a very, very busy year. COVID physicians, nurses, administrative staff very overburdened. Were you able to get to your security risk analysis? And again, nobody, not using this to report on anybody, so this is all internally, but it's interesting, with COVID, we saw better behavior than prior to COVID, when nothing was going on. We saw a little bit of an uptick in taking this seriously in some of the breaches that were happening. So let's finish that up, and I'll display the results here. So I'm going to close and then share this. I don't know if you can see that, but 86% said yes. So congratulations, very impressed. Typically we see, when we ask that question, about 50% of those completed assessments the prior year. So I don't know if the current situation of COVID and a lot that was going on in the breaches caused people to do more, and but for whatever reason they did, and they're to be applauded. So this is a second question, kind of a trick question here, but of that 86%, or any of you, if the OCR knocked on your door today and said, hey, there's been a violation, you're being audited, are you 100% confident you'd pass that audit? So yes or no. And again, there's no wrong here. I just want to show you, what the sentiment of the marketplace is. And this is usually pretty consistent. I'm assuming today, based on those that have done their assessment, there's a little more confidence there. Let's give another second, and I'll close the poll and share the results. So 33% and 68%. So basically 70% are not confident that they would pass, 30% are, and I'm assuming that's by nature. Hopefully those of you that are on this call have used our software, and we give you that 100% pass rate guarantee. But we usually find, this is interesting, about 90 to 100% say if OCR came knocking on our door, we would not be confident. We don't know what they're looking for. We don't know how to put the report together. We don't know how to aggregate the data to calculate our risk. It should run through a threat matrix. So there's a lot of uncertainty there. I'm at least happy to see that number is up 30%. So that's a good thing, and we're moving in the right direction. So thank you. And then this is just a question more out of curiosity. When you did your 2021 security risk analysis, did you do it internally? Did you use spreadsheets? Did you use a methodology there? Or did you use an external assessor to do that? So we'll just give a minute. Actually, we're not going to give a minute. We're going to give 3 more seconds. 3, 2, 1. Okay, so interesting. Looks like about 44% of you did this internally, which is good. And some use the SRAT tool from HHS. It'll get you through the assessment, at least give you a little bit of a framework. Some of the challenges that I see with that tool, it doesn't calculate your risk, so you're left, it's very subjective. You get a guess, is that a high, medium, or low per category? Second thing is it doesn't provide remediation planning or write your final report for you. So at least you're doing something. And this is part of the challenge where we see a lot of people get in trouble for, we did our best efforts, but there were still some areas you missed. Looks like 36% did that externally. Can be costly sometimes, depending on if you're just using an auditor or legal firm without software to do so, but very interesting. And then the 19%, I want you to hold your hand out and slap it. You're going to do better in 2022, for real. So, okay, so what do you need to do? We're about 3/4 of the way through this. What do you need to do as a healthcare organization? Why is it important to complete a comprehensive security risk assessment? Well, here's the process. It identifies the risk. How do you know what to work on if you don't know exactly where your gaps are? So doing a security risk analysis, this foundational piece, it helps you identify those gaps. What are the risks? What could lead to a breach? It creates a roadmap for the year. Here's how we remediate it, and then it'll show ongoing updates that you can do. Some of the triggers that we see for soliciting a security risk analysis, if there's a breach, boy, people repent real quick and try to get one done real time. Cybersecurity hygiene, just we have some CIOs, CISOs that just say, look, we need to do a better job, and they're pushing this initiative internally, and then those that are participating in the MIPS program, it's a requirement. So not only is completing the risk analysis requirement, but it's a vital part of that entire program in receiving some of those reimbursements. So that's key. So your responsibilities. Here's your responsibilities under HIPAA. We get the question all the time, how often do I need to do this? Well, it's annually. You've got to do an annual security risk analysis. It creates that remediation plan and lets you focus on those risks. That's what identifies. It also builds policies and procedures out, so you've got access to those. And then also very important, document your business associates. Make sure you're getting those business associate agreements signed. When do they sign? Any changes? And we even go one step further. Matter of fact, we have a tool, a complementary tool to assist you in collecting your business associate agreements and then asking for assurances that that business associate has completed their security risk analysis. It's not a big percentage, but we have seen an alarming trend and increase in a breach through your business associate, because they're not taking the same security measures that you are. Just understand that you're downstream, you're a dependency, and if there is a breach through them, the provider is the one that the buck stops with. It's your job to make sure that you have that BAA signed and that they are protecting your patient records. So that's like it or not like it, it's the way it is. All right, quick overview of HIPAA One software. So when evaluating any software, whether it's ours or somebody else's, make sure you look that it has the following. Number one, is it up to date with the OCR audit protocols and NIST methodology? NIST is the new framework that OCR just put out. You can adopt that framework. We have a tool, as I mentioned, that we just released that addresses a lot of that. With the software, if you're using our software, you've got access to our auditors. Make sure somebody's available to speak with you. It's going to help calculate risks, put a corrective action plan in place, and then in real time, you've got reporting and analytics. And those are key so that executive level individuals within your organization have access to that. So step one is gathering information, and these are the participants. We want to make sure HR, IT, network and service, IT questions, that's 30% of your security risk analysis. We want to make sure that even if you don't have a full-time IT staff, you're outsourcing this to someone else that can answer or address those questions. HR's got about 9 questions. HIPAA Security Officer has a little bit more. They've got just under 30, and then the facilities manager. We break it down into these different roles, and you've got a dashboard that allows you to see progress. The green represents somebody that's answered all their questions. Red shows you how far they are in the process. You see those little yellow flags that you can flag any questions that you don't understand. What does this mean? I have no clue what they're asking for. And then you can see the HIPAA security question. HIPAA Security Officer hasn't even started, no red or green in there. So it just allows you to track their progress. Now, every question in the gray area, that is the HIPAA citation, 164-308. Well, what is it asking? It's a very, very long question, statement, if you will. And sometimes there's questions in there asking, do you have this? Do you have that? So we've broken those down into very, very simple question here. Does the organization have a policy and procedure where HR notifies staff of termination? So that was what I addressed earlier. Yes, we do. It's going to say, prove it, upload your policy. And it does need to be updated in the last 3 years. So that's key. Second, what if you answer no? Is that a bad thing? We get this question all the time. I do not want to answer no. We don't want to be out of compliance in some of these areas. It doesn't matter. The fact that you know you have a gap and then you put a corrective action plan in place, you're now HIPAA compliant. End of story. And you say, well, wait a minute, we haven't done anything to remediate that. It doesn't matter. The fact that you know you have a hole in the boat and you say, I'm going to patch that hole before I set sail, you're good to go. This is an example of if you answer no. Does the organization have this policy and procedure? No, we don't. Not a big deal. We provide it for you. There it is. So you get that policy, add a policy number, effective date, who approved it, have the board approve it, and there's your new policy. Now, we do often get with our business associates, this is not reasonable and appropriate for our circumstances. Hey, we don't see patients. Okay, well, tell us what the reason is, and that is satisfactory. You can put that in there and go to the next question. So that was very quick, I understand, but that is all the questions. So once you answer that, that's step one. Step two is now remediation. We can now go into our remediation section. Couple cool things I want to point out here. We crosswalk that with the threat and the vulnerability. You also have the risk that it automatically populates. This isn't something you get if you're doing it on your own. You've got to guess, what is the risk? We run everything through a threat matrix. Likelihood times impact equals risk. So the likelihood of that event happening, the impact to the organization, will spit out a risk to the organization. That way we can focus on the high risk first and leave the low risks, to deal with a little bit later. A couple other cool features here. I can assign this specific risk to this individual. All I need is their name, email address, and a target date. It's going to tell in this action plan area exactly what they need to do. So there's no question. Now, if you want to update and modify that, that's definitely okay. Go ahead and do that. But the message here is once I hit submit, it's going to create what I call the auto harass feature. And it's going to say, hey, Steve, you got 3 high-risk items that need to be done, get on it. So that's phase 2 is the remediation planning. Step 3 is the action plan and final report. Couple features here. You've got this current risk status graph. That's kind of nice. You've got your risks that have been updated over time. You've got a letter grade. And if you haven't done a security risk analysis in the past, probably not going to be a very pleasant grade. But as you update these items, it's real time. It's only visible to you and your organization, those that have access to this page. But you'll see that quickly climb as you remediate these items. So that's kind of a neat thing. And then you've also got this action plan that we can come in after the assessment's done. 2 months later, we've had this risk assigned. I can now log in. And this one is, we need another policy and procedure. Okay, here we go. It's drafted pending approval. Once I choose file, I can attach it, click on risk remediated and add. It then updates those graphs that I just showed you. So step 4 is the final report here. Everything is laid out beautifully. Click of the mouse, it produces this final report. Very, very easy to view, to print as a PDF, to send to the OCR if you're getting audited. We have successfully provided to the OCR many of these reports, and we have a 100% pass rate. So that's key. Okay, so the question I always get, how long does this take for each of the individuals that you outlined that's answering questions to go through this process that you're talking about? Depending on who you are and the size of your organization, if you're under 1,000 employees, to answer the question for an HR director, typically 30 minutes. There's about 9 questions. Now, I'm not talking about the remediation. That is going to be, we might give you 5 to 7 policies that you don't have. You'll need to just put your information in the top, put it on your letterhead, get it approved. Obviously, that's going to take you more time, but you've got several months to complete this. I'm talking about just answering the questions. This is the typical time frame you can see here. HIPAA Security Officer is one of the largest, has about 25 to 30 questions. It's a reflexive questioning engine. That will take you a little bit longer. And then, oops, got a little excited there and skipped 2 slides. These are the type of assessments that you can participate in. One is a self-assessment. That's saying we get it, we just need software to automate it. We've got a very sophisticated staff, let us handle it. Or a lot of our year 2 clients say, hey, we can do that second year because you helped us first year. All the data is in the software. You click one button, everything from last year imports into the new year. Okay, so very, very easy to do. The facilitated remote assessment, this is where we do the kickoff call. You've got assessor support. We go through your policies, procedures. We actually review those for you, and then we sign off on your assessment. And then we also have an on-site option or the validated assessment that we go into a lot more detail, help with the scoring, physical walkthrough, things like that. So what do we need to know to provide you very, very quick pricing based on your organization? Is number of locations, is it 1, is it 100? We were able to do last December, 340 location health system, and we finished in 3 weeks based on the scalability of the software. So that was kind of nice. Number of employees gives us just an idea of how long it takes, number of EPHI system, your primary EHR, RIS, PACS, what else do you want to add, and then what assessment type. If you can provide us with that information, very, very easy to go through that. So I am a big believer in being sensitive on time. So we are 32 minutes past the hour. We've got one final question here that I'd like to tee up. We've covered a lot of information today. And if you're interested, sorry, I've got allergies and my throat is having a lot of fun with me right now. What do you want to learn more about? We're happy to reach out and talk to you a little bit more custom solution, and we won't display the results on this, but on security risk analysis, if you're not using our software, hey, you know, how much is that going to cost? And again, E is, we're here for educational purposes. Awesome. Check the box. You've been trained, and continue to come to this. We'll have a NIST webinar. We've got information on HITRUST, a lot of good information there. I see privacy and breach. Not a lot of people do that. Security, it's driven annually, part of the program. So that is something people are consistent with. Privacy and breach, more policy and procedure driven. And we can see getting away with doing one of those every 3 years. So if you're one of our current clients doing the security risk analysis, let us know, check the box on privacy. We can show you what that looks like, provide cost for you. HIPAA workforce training, if you have a PowerPoint, I want to just explain a little bit what we have there. We have different types of training. So a provider, they get it, they went to medical school. Theirs is very, very quick, high level. Administrative staff, completely different than what we're going to share with a provider. And IT, you know, IT, they don't see patients. They're not in the front office. They're kind of behind the scenes. So there's customized training. If you have specific training that you would like us to input into our training platform, we can do so and create custom quizzes for your type of organization. And then one that we used to get a lot of requests on, and just based on bandwidths, wasn't something we did a lot of it, but remediation services. This is where I was mentioning Enterprise Health has a very, very deep bench, a lot of different products and services. So if you're interested in having us, just reach out and go through. Here's 5 of the different software and services that they provide. We know what the gaps are. They can help you, and if they can't, they can provide direction on what you could do there. So anyway, thank you for your time today. And if you do have any questions, feel free. Let me just tee up this second slide here. You can send an email to info@enterprisehealth.com, call us on our number, or you can see enterprisehealth.com there. And thank you for your participation. And again, the custom conversations is what we absolutely love. And I apologize, I spoke really fast, covered a lot of things high level, but wanted to give you some of your day back. But if you do have specific questions that you didn't ask today and say, you know what, we're unique, blah, here it is. We're happy to have that dialogue with you and help provide solutions. And it may not be you using our software. It just might be some good ideas. Look at this. That is what we're here for. So we want to be able to help healthcare industry as a whole up their compliance, up their security, and try to thwart off some of the attacks that are continuing to happen on a daily basis. So with that, thank you. And we will see you next time on the next webinar. Have a good afternoon.